Namaskar दोस्तों, good evening friends. I am Dr. Sanjay Kalra, your friendly endocrinologist, and you are watching Dr. KK's Med Talks, Mondays with Dr. Sanjay Kalra. आज के हमारे नॉन स्टॉप शो का 709वां 709th एपिसोड है. Let's have the headlines for today. लंग कैंसर इज अ डेंजरस डिजीज. लंग कैंसर एक खतरनाक बीमारी है और ज्यादातर ये देखा गया है that it occurs amongst smokers. But now the incidence is rising amongst non-smokers as well. That's because of passive smoking, partly. Concern over monkeypox virus is rising in India as a 22-year-old boy has died recently. ये हमारी पहली मौत है monkeypox की वजह से. Unfortunately, this young man had returned from the United Arab Emirates. He knew that he had monkeypox and he did not disclose it to the authorities. Neither did he disclose it to the treating doctors. The United Nations report suggests that 4,000 people are infected with HIV across the world every day. तो HIV की जो इन्फेक्शन है वो अभी भी जारी है और 4,000 लोग रोज इसके शिकार बनते हैं. Treatment of COVID with Pfizer's antiviral drug Paxlovid has been shown to cause a rebound of infection, which can be infectious as well. इसका मतलब ये है कि यदि आपको कोविड है और आप फाइजर की दवाई लेते हैं पैक्सलोविड, जैसे कि अमेरिका के राष्ट्रपति ने फिलहाल लिया, इन्फेक्शन तो ठीक हो जाएगी बट उसके बाद फिर रिबाउंड आता है, फिर से इन्फेक्शन आती है और वो इन्फेक्शन बाकी लोगों को भी हो सकती है. दिस इन्फेक्शियस डिजीज मे नॉट हैव सिम्टम्स. इट इज पॉसिबल कि आपको लक्षण ना दिखाई दें मगर फिर भी आप ये जो कोविड है ये बाकियों को फैला सकते हैं. सो वन हैज टू बी केयरफुल. And COVID routine immunization has been rolled out in 2 districts of the country. With these headlines, let's go to our topic for today. A very topical topic. एक बहुत ही important topic. हमारा आज का टॉपिक है हार्मोन्स, यूज एंड मिसयूज. हार्मोन्स क्या चीज है हम जानेंगे अभी अपने गेस्ट से. हार्मोन्स की हिंदी क्या है, हार्मोन्स की उर्दू है, आप सबको क्या है, आप सबको पूछते हैं. So let's ask everybody, what is the Hindi word for hormones, the Urdu word for hormones? And while we're at that, we might as well discuss the Hindi and the Urdu for our subject, endocrinology, and for glands. तो हिंदी, उर्दू या आपकी जुबान में, आपकी लोकल लैंग्वेज में इनके मतलब क्या है? Endocrinology, glands and hormones. While we look for the answers for that, we welcome our special guest today. Our guest is Dr. Joe George. Dr. Joe George is a consultant endocrinologist at the Endodive Clinic in Kozhikode or Calicut in Kerala. We'll be waiting for him to join. In the meanwhile, हम welcome करते हैं Dr. भालचंद्र मेश्राम को, Dr. संजीव पुरी पंजाब से, Dr. रमेशपाल सिंह पवार सर जो पीडियाट्रिशियन है, अनामिका अनु मैडम, स्वप्ना जैन जी वेलोर से एंड ललित कथुरिया साहब जो सोनीपत हरियाणा से हैं. अब हार्मोन्स की बात करते हैं. लेट्स टॉक अबाउट हार्मोन्स. हार्मोन्स क्या चीजें हैं? इसको हिंदी में कहते हैं आंतरिक रस. ये रस है बॉडी का. ऐसी चीजें हैं जो बिल्कुल छोटी छोटी बारीक क्वांटिटी में बनती हैं हमारे ग्लैंड्स में. ग्लैंड की उर्दू है गुदा, उसमें बनती है और वहां से ब्लड में फैलती है, पूरे ब्लड में घूमते हुए पूरे शरीर पे असर करती है. एग्जाम्पल्स हैं हार्मोन्स के जैसे कि थायराइड या इंसुलिन, इन सबको हम जानते हैं. कुछ एक और हार्मोन्स हैं जैसे सेक्स स्टेरॉइड्स हुए, टेस्टोस्टेरॉन, ईस्ट्रोजन, इन सब के बारे में भी हमें पता है. कुछ एक हार्मोन्स हैं जो ब्रेन से निकलते हैं और बाकी शरीर के ग्लैंड्स को या अंतःस्राविकी वाली जो ग्रंथियां हैं उनको स्टिमुलेट करते हैं या उनको सप्रेस करते हैं. अब हार्मोन्स हम कैसे यूज करते हैं डिजीज में और हम कैसे यूज करते हैं हेल्थ में, इसके बारे में हम जानेंगे और देखेंगे कि इनको यूज करना और इनको मिस यूज करना हमारे हाथ में है और हम कैसे इनका ख्याल रख सकते हैं. So one by one, let's talk about the hormones. We also welcome Vinny Joglekar ji from Bangalore and Dr. Pratima Srivastav from the USA. So अब हार्मोन्स की जो डिजीजेस हैं, एंडोक्राइन डिजीजेस, इनको हम कैसे क्लासिफाई करते हैं? आसान तरीका है 3 में बांटने का. The easy way is to classify them into 3. First of all, you have diseases of hormone deficiency, जबकि हार्मोन कम होता है. एग्जाम्पल्स होंगे ग्रोथ हार्मोन डेफिशिएंसी, जिसमें हाइट कम रह जाती है बच्चे की. हाइपोथायरॉयडिज्म, जिसमें थायराइड हार्मोन कम होता है, इंसुलिन डेफिशिएंसी या डायबिटीज, इंसुलिन की कमी, उसकी वजह से डायबिटीज हो जाती है, कैल्शियम की कमी, विटामिन डी की कमी, और एक हार्मोन होता है पैराथायरॉयड हार्मोन, उसकी कमी। ये सब मिक्स्ड हैं, इंटरलिंक्ड हैं, बट विटामिन डी डेफिशिएंसी से रिकेट्स होती है, ऑस्टियोमलेशिया होता है। अगर कैल्शियम डेफिशिएंसी हो, उसके अलग लक्षण होते हैं। वार्म वेलकम डॉक्टर जो।
Hi, sir.
So we were just introducing you, Dr. Joe, and I'd like to once again introduce you. Dr. Joe is a consultant endocrinologist at Calicut or Kozhikode in Kerala. He has done his DM, his fellowship in endocrinology from the prestigious Mumbai University, from KEM Hospital, Mumbai. And now he's a known figure across the country in diabetes education, in endocrine education. Dr. Joe, we were talking about hormones and we were classifying hormonal diseases into three. So we said that the first type of disease is the one where there is hormone deficiency, and we listed a few. And then we had two more groups. The second one is where there is hormone excess, and the third is where there may be a hormonal cancer, an endocrine cancer. So what is your take on this? In your OPD, which are the common deficiencies that you see? Which are the common excess conditions that you see?
The commonest, सबसे कॉमन जो है वो थायराइड का होता है, हाइपोथायरॉइडिज्म हम लोग बोलते हैं। थायराइड का डेफिशिएंसी सबसे कॉमन होता है हमारे ओपीडी में, एंडोक्राइन ओपीडी में। और उसके अलावा डायबिटीज, जो पैंक्रियास में जो इंसुलिन जो बनाता है, इंसुलिन भी एक हार्मोन है, और वो इंसुलिन का जो डेफिशिएंसी होता है वो सेकंड कॉमनेस्ट कोज होता है। ये दोनों सबसे कॉमन है, लेकिन मेरा मानना है कि ये दोनों बीमारी लोग हार्मोन डिजीज नहीं कहते हैं ना। Diabetes, nobody considers diabetes as a hormone disease most of the time. They don't recognize that.
While actually it is a hormonal deficiency actually. So now let's talk about these hormonal deficiency diseases. There are so many hormones that we use. For example, if there is a thyroid deficiency, we'll use thyroid hormone. If there is insulin deficiency, we'll use insulin. And suppose somebody has testosterone deficiency, any male, or somebody has estrogen deficiency, any lady or girl, then we will use those. So what goes on in your mind? Endocrinologist ke man mein kya kya chalta hai? What goes on in your mind before you prescribe a hormone? Do you prescribe it like toffees and ice cream and chocolate, or do you have to think before prescribing?
So, as always with any disease, with any doctor, he always wants to find out क्यों हो रहा है ये क्यों हो रहा है। अगर कुछ हार्मोन का डेफिशिएंसी या कुछ बीमारी हो जाए, तो पहले हम लोग ये देखते हैं कि वो क्यों हो रहा है, और वो और कुछ सेकेंडरी कॉजेस के वजह से जो बिना ट्रीटमेंट का या कोई और तरीके से वो ठीक कर सकते हैं कि नहीं, वो हमें पहले पता करना चाहिए। तो उसके बाद ही हम लोग दवाई चालू करते हैं। सो व्हेनेवर यू सी अ डेफिशिएंसी, पहले ही डायरेक्टली हार्मोन चालू करना वो हमारा बस हमारा द मेथड नहीं है। हम लोग पहले ये चेक करते हैं कि वो एग्जामिन करते हैं, हिस्ट्री लेते हैं और देखते हैं कि वो क्यों हो रहा है, वो कुछ बीमारी की वजह से हुआ है, और जो बीमारी भी है तो वो अपने आप ठीक हो सकता है, या वापस वो कुछ थोड़ा टाइम दवाई देने से वो ठीक हो सकता है। एंड आफ्टर एवरीथिंग इज रूल्ड आउट, और फाइनली वी हैव रीच्ड द फाइनल कंक्लूजन कि इसके वजह से ये हो रहा है, और वो बीमारी जो है वो भी ट्रीटेबल नहीं है, क्योरेबल नहीं है और रिवर्सेबल नहीं है, वो टाइम पे हम लोग हार्मोन देने का सोचते हैं।
Yes. So, Dr. Joe, lots of people logged in. Dr. Srivastav from the USA is greeting you. Anita Dadlani ji saying good evening. Dr. N.S. Sharda sir, a very senior physician from Ahmedabad, sending you his blessings and regards. Jyotika Rana ji saying namaskaram. And Inam Sahab from Pakistan wishing you adab.
Thank you, adab.
So our topic for today is use and misuse. ये तो आपने बता दिया कि when you use hormones, you have to think before prescribing. You need a reason. Reason मिल जाए तो बहुत अच्छा, ना मिले तो at least you should be confident कि कोई ऐसा reason नहीं है जो जानलेवा हो. There should be no reason which can be life threatening in future or which can be organ threatening, जो अंग लेवा हो, जो कल को आपके organ को तंग करे या आपके function को तंग करे. Let's take an example. मान लो कोई बच्चा आता है एंड we'll go this is for the audience, we'll go one by one. In general, when we discuss endocrinology, we have a list of 6 major organs to discuss, 6 major glands, so we'll just go from head to toe. But आप questions पूछते रहें, and अभी हाल ही में in 2 or 3 minutes we will take the question from Inam Sahab from Pakistan about thyroid. Supposing एक बच्चा आता है डॉक्टर जो आपके पास, the child has short stature, उसके मम्मी पापा कहते हैं कि मेरा बच्चा ग्रो नहीं कर रहा, आपने 6 months बच्चे को देखा, उसकी ग्रोथ वेलोसिटी नहीं थी, द चाइल्ड डिड नॉट ग्रो, वो स्कूल में क्लास 2 से 3 से 4 में चला गया, बट उसके जूते नहीं बदले, उसकी यूनिफॉर्म नहीं बदली. Somebody does a random growth hormone test and finds out कि growth hormone कम है. Would this be use of growth hormone? That's the first question. Second is, would it be misuse of growth hormone? And can you tell us some examples where actually, if you use growth hormone in such a way, you might end up harming the child, maybe his life, maybe her eyesight. So, what are the common conditions that you have seen where misuse can occur for growth hormone?
Yes, growth hormone in a child, usually the proper diagnosis is very important. So in this case, when the shoe size is not increasing, the height is not increasing, there's a definite, and the doctor has actually monitored the child for 6 months period, that indicates that there is no growth that is happening. So definitely there is a pathology that is involved. Here, the first concern would be, why is that happening? Again, the question why is very important. So a random growth hormone is definitely not the answer to that. We would have to do a stimulation test of growth hormone, and also we'll look into IGF-1. IGF-1 इंसुलिन लाइक ग्रोथ फैक्टर 1, उससे ग्रोथ हार्मोन का एंड इफेक्ट होता है. तो IGF-1 करने से हमें ये पता चलता है कि वो IGF-1 लो होता है, तो इट्स एन एडेड information that probably the patient is having a deficiency of growth, or there is any secondary disease that could be producing growth hormone effect, that is lack of growth hormone effect. तो वो पहले करना पड़ेगा. और अभी ग्रोथ मॉनिटरिंग तो हो गया, तो वो हमारे पास है. तो सेकंड पार्ट जो है वो स्टिमुलेशन टेस्ट करना है. देयर आर लॉट ऑफ स्टिमुलेशन टेस्ट. जो भी डेफिशिएंसी का डायग्नोसिस अभी ग्रोथ हार्मोन के ले लो या ज्यादातर हार्मोन का डिजीज का ले लो, तो डेफिशिएंसी डायग्नोस करने के लिए हम स्टिमुलेशन टेस्ट करते हैं, यानी कि हम वो उत्तेजित करने का तरीका देखते हैं, और कोई दवाई या और कोई अलग वजह चीजों से वो हार्मोन को ज्यादा बढ़ाने का टेस्टिंग के तौर पे बढ़ाने का कोशिश करते हैं. And we try for that stimulation test, and if that also fails, then that becomes an added indication that the patient is having a growth hormone deficiency. वो हो जाने के बाद अभी ग्रोथ हार्मोन का ले लो, तो जैसे कार्ला साहब ने बताया, there are 6 organs in the body mainly from the endocrine perspective. तो ये जो ग्रोथ हार्मोन जो है वो पिट्यूटरी से आता है. तो नेक्स्ट स्टेप जो होगा, वो पिट्यूटरी एक मास्टर ग्लैंड है हमारा शरीर का. तो वो मास्टर ग्लैंड में ग्रोथ हार्मोन ही नहीं, देयर आर अदर हार्मोन्स दैट आर सिंथेसाइज्ड, लाइक थायराइड हार्मोन का जो स्टिमुलस जो होता है, और बाकी गोनाडल हार्मोन जो रहता है, प्रोलैक्टिन जो रहता है. So there are other hormones also produced from that gland. So we'll check the other hormones also to see whether the other hormones are also affected. वो देखने के बाद अगर उसमें भी इफेक्ट हो गया, तो वो एडेड एविडेंस रहता है कि ग्रोथ हार्मोन का भी डेफिशिएंसी जो है वो सही है. और उसके बाद अगर हम लोग वो प्रॉब्लम मालूम होता है हमें कि ग्रोथ हार्मोन डेफिशिएंसी है, तो फाइनली वी हैव टू स्कैन, डू एन एमआरआई स्कैन ऑफ द ग्लैंड, बिकॉज ऐसा भी हो सकता है ज्यादातर बच्चों में क्रेनियोफेरेंजियोमा या और कुछ ट्यूमर्स के वजह से भी वो ग्रोथ हार्मोन का डेफिशिएंसी हो जाए. तो अगर वो ग्रोथ हार्मोन डेफिशिएंसी जो हो गया है वो कंजेंटल ग्रोथ हार्मोन डेफिशिएंसी है, तो ग्रोथ हार्मोन देना सही रहेगा. अगर वो ट्यूमर के वजह से हुआ है, तो पहले हमें वो ट्यूमर को टैकल करना पड़ेगा. वो ट्यूमर, वो बीमारी जो इसका ग्रोथ हार्मोन का डेफिशिएंसी किया है, वो बीमारी को पहले हमें सही करना पड़ेगा. उसके लिए जो इलाज चाहिए वो करना पड़ेगा. उसके बाद ही हम ग्रोथ हार्मोन का ट्रीटमेंट के बारे में सोचते हैं. जैसा संजय कलरा साहब ने बताया, अगर वो पहले वो जो रीजन जो है, जो ग्रोथ हार्मोन डेफिशिएंसी था, वो टैकल किए बिना हम लोग ग्रोथ हार्मोन, सीधा ग्रोथ हार्मोन देने पे चला जाता है, तो वो ट्यूमर बड़ा भी हो सकता है, और दैट कैन लीड टू more serious complication to the child, and child may even become blind and even develop seizure or may die also because of that.
So these are some things that we have seen in practice, and we must be careful. अगर आपने घर पे सब्जी बनानी है, पुलाव बनाना है, तो उसमें बहुत सारी चीजें डलती हैं. आप ये थोड़ी ना कह सकते हैं कि मैंने बस नमक डाल दिया और मिर्च मसाला तो कोई और डालेगा. तो इसी तरह से ही जब आपने बच्चे की हाइट बढ़ानी हो या किसी चीज को भी ठीक करना हो तो आपको सारे पहलू देखने हैं. यू हैव टू सी ईच एंड एवरी एस्पेक्ट ऑफ द डिजीज. और यदि आपकी नींव ही ठीक ना हो, इफ यदि आपकी बुनियाद, इफ योर फाउंडेशन इज नॉट स्ट्रांग, देन यू कैन नॉट बिल्ड अ स्ट्रांग बिल्डिंग. सो इफ यू don't know the reason for growth hormone deficiency, if you don't know whether there is a tumor or not, you can get into trouble. हमारे साथ लड्डू जी लॉग्ड इन हैं हरियाणा से, और लड्डू साहब कह रहे हैं कि कुछ लोग अपना पेट बढ़ाने के लिए लड्डू खाते हैं, विच इज ट्रू. आई थिंक ही इज टीजिंग मी. और कुछ लोग जिम में जाके ग्रोथ हार्मोन के इंजेक्शन लगाते हैं या स्टेरॉइड के इंजेक्शन लगाते हैं. सो व्हाट ही वांट्स टू नो इज, आई एम अ यंग हेल्दी एडल्ट. He is a 33-year-old gentleman and very smart, very handsome. He wants to go to the gym and he wants to build those super duper biceps and those six abs. The gym guy tells him that you must take growth hormone and steroids because that is the only way you can build muscles. So he wants to know what is the rationale behind this. How should I counter the gym expert, the so-called expert?
सी या सी हम लोग जब सोचते हैं तो हर टाइम पे हम ये सोचते हैं कि ये जो अब्यूज जो होता है हॉर्मोन्स का, वो ज्यादातर ये एथलीट्स में होता है, या वो जो ओलंपिक्स में भाग लेते हैं या एशियाड में भाग लेते हैं उन लोगों में से होता है. लेकिन सच ये है कि वो बहुत ज्यादा जो है वो रिक्रिएशनल यूज में, और वो जो ये सा बॉडी रिक्रिएशनल बॉडी बिल्डिंग बोलते हैं, जो कॉम्पिटिटिव नहीं है, उसमें ज्यादातर ये मिसयूज होता है. And in this case also, it's a typical example of what happens, that when you go to the gym, everybody looks for a shortcut. Everybody wants to have the results very fast, and they look for shortcuts. And one only thing what I can tell you is here is that देखो ये सही नहीं है, क्योंकि आप अच्छा खासा जेंटलमैन है और आप तंदुरुस्त है, कोई बीमारी नहीं है. अगर हम आपका शरीर में जो जितना हार्मोन होना चाहिए, वो तो होगा ही. तो उस वो आपका मसल्स बढ़ाने के लिए अगर आप बाहर से ज़्यादा वो जो हार्मोन बाहर से अगर सुप्रा फिजियोलॉजिकल यानी कि जो आपके शरीर को चाहिए, उससे कहीं ज़्यादा अमाउंट पे लेना पड़ेगा. तो ऐसा लेगा तो उसका साइड इफेक्ट्स बहुत ज़्यादा रहता है. वो ज़्यादातर लोग उसके बारे में बात नहीं करते, और ये जो जिम वाले हैं और बाकी जो दवाई या ब्लैक बैकग्राउंड में या इलीगली जो दवाई सप्लाई करते हैं और उसके बारे में बात करते हैं, वही साइड इफेक्ट्स के बारे में ज्यादातर बात नहीं करते. और अगर आप नेट में भी जाके वो पता करें और उस वो लाइटली बोल देते हैं, अरे वो सब उसमें लिखा होता है लेकिन कुछ होता नहीं है, मेरा मेरा मान लो कुछ होता नहीं है. वही तो सब लोग हमारे पास भी आता है डॉक्टर पूछने के लिए, राय पूछने के लिए, मुझे ये जिम वाले ने ये बताया या कोई दूसरा दोस्त ने ये बताया, वो 6 महीने से ले रहा है, उसको कोई कुछ नहीं हुआ है. लेकिन जो साइड इफेक्ट्स जो है वो बहुत ज्यादा रहता है, और उसका जो इफेक्ट जो है वो आपका जिंदगी भर रहेगा. जो उसका जो आपके शरीर पे जो नेगेटिव इफेक्ट जो हुआ वो जिंदगी भर रहेगा. और अभी इमीडिएटली जो है वो शायद आपका स्पर्म काउंट कम हो जाए और आपका आपका मसल थोड़ा बन बन जाएगा, लेकिन वो इंजेक्शन बंद करने पे वो सब वापस पुराने तरीके जैसे जैसा हो जाएगा, और जो साइड इफेक्ट जो है वो पर्सिस्ट हो जाएगा. और बाद में आगे में आपको हार्मोन्स का जो स्पर्म काउंट का, कैंसर का, हार्ट डिजीज का, बहुत सारे प्रॉब्लम्स हो सकता है, स्ट्रोक का, हार्ट अटैक का, वो सब प्रॉब्लम्स हो सकता है.
राइट. तो जो डॉक्टर जॉर्ज कह रहे हैं वो ये है कि जब भी कोई दवाई लेनी हो, कोई भी हार्मोन, वो तभी देंगे अगर वो डेफिशिएंट हो, अगर वो कम हो. जब आपके हार्मोन्स ठीक हैं तो आप एक्स्ट्रा क्यों लें? अब ये जो हार्मोन्स हैं, ये हमारे खून में घूमते हैं, वी हैव ऑलरेडी सेड दैट. इनका उपयोग भी होता है. यदि वो हार्मोन कम हो तो उसे देना उपयोग है, इट इज अ यूज. यदि वो पहले से ही ठीक हो और हम उसे अननेसेसरली ऐड करें, दैट इज अ दुरुपयोग, दैट इज एन अब्यूज, वो गलत इस्तेमाल है. होता क्या है कि ये जो हार्मोन्स हैं वो चाबी की तरह काम करते हैं, दे वर्क लाइक अ की. ये जो चाबी है अलग-अलग ताले खोलती है. अब अगर आपने मसल्स बनानी है और सिर्फ मसल्स बनानी है, तो आप ऐसी चाबी ढूंढेंगे जो सिर्फ मसल्स के ताले को खोलेगी. एंड आई एम अवेयर ऑफ ओनली वन ट्रीटमेंट फॉर दैट, वी विल जस्ट डिस्कस दैट शॉर्टली. मगर ये जो ग्रोथ हार्मोन है या जो स्टेरॉइड्स हैं, ये अलग-अलग तालों को खोलते हैं. तो और कई जगह ताले बंद भी कर देते हैं. तो ये आपकी मसल्स में जाके ताले तो जरूर खोल देंगे, तो मसल्स बन जाएंगी. पर जब आप बंद करोगे, चाबी हटाओगे, फिर वो ताला जाम हो जाएगा. और साथ के साथ ही ये आपके टेस्टिस में जाके, अंडकोश में जाके, वहां पे तालों को जाम करेंगे, तो स्पर्म नहीं बनेंगे, इनफर्टिलिटी हो जाएगी. शुगर हो सकती है, थायराइड हो सकता है उससे, ब्लड प्रेशर बढ़ सकता है, और खून गाढ़ा हो सकता है और उसकी वजह से अधरंगे हार्ट अटैक हो सकते हैं. तो ये चीजें लोग ज्यादातर नहीं बताते। और कई बार ना किशोर अवस्था में, इन यूथ, इन एडोलेसेंस, वी टेंड टू गेट कैरिड अवे बाय शॉर्ट टर्म डेफिनेशन ऑफ हेल्थ, जबकि एक्चुअली भगवान ने, अल्लाह ने हमें बनाया, गॉड हैज मेड अस टू लिव फॉर 100 years. सो वी शुड थिंक ऑफ सस्टेनेबल हेल्थ, नॉट शॉर्ट टर्म हेल्थ. Dr. Joe, many other people logged in as well. Jaya Channa ji, Kudrat Wazir ji, all saying good evening to you. Pooja ji, Dr.
Good
Girish
evening.
Chatle is a surgeon from Karnal. Kavita ji, Mr. Sharma is a nursing faculty at SGPGI Lucknow. And lots of questions coming in. So we've talked a little bit about the pituitary and how you can use growth hormone to improve height, but you can also misuse growth hormone in the gym setting for recreational bodybuilding. There is a question from Imam Sahab and another question from Kavita ji. They ask about thyroid. So, एक तो specific question है. When I get my thyroid function test, should I get it done early morning or fasting, or is it not necessary? And दूसरा है, please tell us about misuse of thyroid gland hormone.
Yeah, first question, when you have to do the thyroid testing, TSH testing can be done any time of the day because most of the hormones we say that there is a diurnal variation और वो जो दिन का टाइम के हिसाब से वो उसका लेवल ऊपर नीचे हो सकता है, लेकिन ये सबसे कम थायराइड के हार्मोन पे रहता है. So the diurnal variation is least for thyroid hormone. So most of the time you will get the values almost correct whether you do it in the morning or evening. But all said and done, we should understand that most of the hormones जो टेस्ट जो है उसका नॉर्मल वैल्यू जो है वो दैट हैज बीन कैलिब्रेटेड between 8 a.m. and 10 a.m. So all the hormone calibrations are done between 8 a.m. and 10 a.m. So if possible, it's always better to do between 8 a.m. and 10 a.m. But it doesn't actually matter that much even if you do a thyroid function in the evening also. That's the first part of it. And second part is the use and misuse of thyroid hormone. See, as Kalrasar has already mentioned, everything in the world, if it is used in the proper indication or in the proper position, proper indication, the proper dose, it's just like Amrit. And if it is used improperly, in the improper position, in the improper usage, it becomes wish. And this was said by Kalrasar in the last meeting, not this meeting. Okay, yeah. So it is actually anything which is used up in a wrong position for any wrong indication, it becomes wish, not Amrit. And there are a lot of misuses, and I don't know whether I should mention all misuses, giving them a clue that where all they can use it. Sir, what do you think?
Some that you've experienced in your OPD, where people come in misusing thyroid hormone and then they get in trouble because of that.
Yeah, see,
And
misuse.
sometimes it may not be the patient's fault also. It may be our fault as a doctor. Maybe we mislabeled. So anything that you experienced in the last 1 or 2 weeks in your clinic?
Yeah, see, misuse. Sometimes people come with fatigue and weight gain, hair loss. These are common symptoms. These are very common symptoms that if you take 10 people around you, half of them would be having at least few of those symptoms. And if you actually Google the symptoms of hypothyroidism, that is जो thyroid hormone जो less कम रहता है, उसका symptoms अगर आप Google करके देखते हैं तो आपको पता चलेगा कि 2 या 3 symptoms सबको होता है. So it's so non-specific that sometimes doctor also is misled by the symptoms and starts a small dose of thyroid hormone, and then the people go into the level of hyperthyroidism, यानी कि शरीर में जो ज्यादा हार्मोन रहता है उसका symptoms manifest करना चालू होता है, like tachycardia, anxiety, tremulousness. They become very anxious and irritable. So these symptoms जो होता है, we sometimes come across those people, and sometimes people even take out of the box without prescription for weight loss. Weight gain is something for which people tend to take thyroid hormone, thinking that thyroid hormone के वजह से ये सब weight होता है. But that is not true, and that is a common thing that happens, and they tend to manifest side effects which I already mentioned. Hormone ज्यादा होगा तो भी उसका side effect रहता है और वो manifest होता है.
We've talked about thyroid and the fact that sometimes it is prescribed unnecessarily और उसकी वजह से गड़बड़ भी हो सकती है. एट द सेम टाइम थायराइड को मिस भी नहीं करना चाहिए. तो ये जो यूज और मिस यूज, उपयोग और दुरुपयोग का जो डिफरेंस है वो कई बार बहुत ही सटल, बहुत ही नाजुक होता है, बहुत बारीक होता है. इट इज समटाइम्स वेरी डेलिकेट. तो आप अपने एंडोक्रिनोलॉजिस्ट को ट्रस्ट करें, अपने डॉक्टर को ट्रस्ट करें. एंड स्पेशली इफ इट इज अ कॉम्प्लिकेटेड केस और इफ इट इज अ बॉर्डरलाइन केस, आपकी लैब आपको बोल रही है द थायराइड इज 0 to 5, लेट अस से नॉर्मल, द टीएसएच इज नॉर्मल, एंड योर टीएसएच इज समटाइम्स कमिंग एज maybe 5.8, 5.3, 6.2, and it varies from time to time. then in such a case, you must go to the endocrinologist before deciding whether to take therapy or not to take treatment.
So
There
yeah,
is,
so here, sir, may I interrupt? Actually, see, one thing common problem that happens in our part of the world is people tend to just look into the normal value and decide whether the value is correct or not. See, always, it's not always true that the lab normal actually looks normal. There are certain conditions like अभी thyroid का ही ले लो, तो central hypothyroidism जो pituitary का बीमारी रहता है, उसमें TSH नॉर्मल रह सकता है और उस वो टाइम पे भी T3 T4 लो रहेगा और वो टाइम पे भी हमें थायराइड का टैबलेट देना पड़ता है और समटाइम्स ऑन ट्रीटमेंट फॉर पिट्यूटरी डिजीज द टीएसएच बहुत कम भी आ सकता है लेकिन जो टैबलेट जो है वो कंटिन्यू लेना पड़ेगा so all it's not always mandatory that the lab normal is the normal for every person but in the normal usual scenario lab normal is the normal
for most. And Dr. Joe, let's talk about this. Yes, Semwalji is saying Sadar Pranam to you, greeting you. And a very important question coming from Pooja ji. But before that, um, what is the right way? We are talking of misuse of hormones, but let's talk about misuse of hormone tests. Now, traditionally, what medicine is taught is whether it is Ayurveda or whether it is modern medicine, that first you ask questions. That is prashan chikitsa in Ayurveda. Then you examine the patient. That is sparsh chikitsa again in Ayurveda. And after that you investigate. But now direct access testing is available across India. And sometimes the rates are so economical that you actually, sort of are forced to think whether actually the test is being done or not. 2 days ago, I had an elderly gentleman with an HbA1c of 11.97. Now, he got it done. He got it done from a lab of his choice. We prescribed insulin. He was unhappy. So he lives 40 kilometers away. And today he was back, sir. Now I've got it done from this lab. Now it is 8.3. So which one do we believe? I don't know. So on one hand, I told him, you should be a bit more trusting and don't be so mistrustful. He says, no, the first lab is wrong and the second one is good. So I said, what makes you think the second one is good? And the first one didn't come home to invite you to get the test done. You went on of your own free will. Why did you go there? Because he was giving 200 rupees discount. So then I said, okay, you don't trust the first lab, you trust the second one. Do you trust me or not? So he said, yes, I trust you. Then I said, then you please take insulin. So he was on 5 tablets. But anything you've experienced in practice where people go in for direct access testing and then they begin treating the test report instead of treating themselves? Any example
so
that comes to your mind?
this is very common. I often remember my teacher for my MD, where the most difficult part of our evaluation or day-to-day rounds was he would ask reason for each and every test that is done, and I need to have an explanation for even the simplest of the blood test that is done or the urine test that is done. So unless you have a something in mind which made you do that test, he would actually scold you like anything, saying that if you don't think of the end result, don't do the test. So unless you are able to interpret the test, you shouldn't do. But as things have changed here in India, we have a lot of packages that are there. So people say that complete test kiya hai, complete hormone test kiya hai, and they come up with the results sometimes abnormal, and then we are actually going from the result to the question. So we then have to go back. देखो आपने ये क्यों किया, क्योंकि पैकेज में किया है, सब कुछ किया है, तो आप अभी बताओ कि ये जो डार्क और या रेड जो लिखा है उसका एक्सप्लेनेशन क्या होता है. It becomes a very difficult scenario. And one thing always we should remember is that, as Kalrasar has just pointed out, we are not treating the hormone results. We are not treating any results. We are treating the person as a whole. And then we have to look into the scenarios. There are so many things. And even see, ये जो blood testing जो होता है, don't think that all of them are foolproof. There is coefficient of variability. जो हम लोग जो statistics जो पढ़ते हैं उसमें we know that there is a certain range of range जो होता है और डिपेंडिंग ऑन द सिनेरियोस, डिपेंडिंग ऑन द सिचुएशंस. अभी बीमारी के तुरंत बाद चेक करेंगे तो थोड़ा हार्मोन्स इधर उधर हो सकता है, वो अपने आप नॉर्मल हो जाएगा. सो देयर आर सो मेनी things which we have to keep in mind before we order a test. So when a doctor orders a test, knowing what is see, he has something in his mind why he would have ordered that. So he is ready to interpret it, and that's a correct clinical scenario जो होता है. अभी देखो, अभी एक लेडी का ये बात ले ले जो उनका एक पीरियड्स का टाइम रहता है, जो इनिशियल फर्स्ट हाफ ऑफ मेंस्ट्रुअल साइकिल जो रहता है, सेकंड हाफ ऑफ मेंस्ट्रुअल साइकिल जो रहता है, ईच टाइम पे उनका जो हार्मोन्स जो है ना, वो एकदम चेंज डिफरेंट रहता है. सो डिपेंडिंग ऑन द टाइम ऑफ द साइकिल, एफएसएच, एलएच, ईस्ट्राडायोल, वो सब का लेवल एक एंड से दूसरा एंड तक हो सकता है. So it's very difficult to interpret when you just go there and do the test and come back and show you, doctor अभी ये रिजल्ट के बारे में बताओ. So then when a doctor actually endocrinologist or a hormone specialist or a physician जब आपको प्रिस्क्राइब करता है, तो वो एग्जैक्ट पक्का टाइम पकड़ के वो टेस्टिंग करने को बोलता है और सिचुएशन देख के बोलता है. then only we will be able to interpret a lot of tests. So sometimes we will be having to ask you to do it again in the proper way to analyze it better.
हमारी फिलॉसफी भी कहती है, इंडियन फिलॉसफी ये कहती है कि द राइट एक्शन इन द राइट डायरेक्शन विद द राइट इंटेंशन, ये 3 चीजें कही गई हैं ट्रेडिशनल इंडियन फिलॉसफी में. सही एक्शन, सही दिशा में और सही मंशा से यदि आप ये करें, देन यू आर ऑन योर वे टू हार्मनी एंड हेल्थ एंड हैप्पीनेस. तो अब जब वो डायरेक्शन गलत हो जाती है ना, कि पहले टेस्ट कराया और उसके बाद आप सेहत ढूंढने बैठो, तंदुरुस्ती ढूंढने बैठो, तो कभी कभी गड़बड़ हो जाती है. सो इफ लेट अस से योर सीआरपी इज स्लाइटली हाई और योर ईएसआर इज हाई और योर हीमोग्लोबिन इज 1 point up or down, don't worry too much. What your endocrinologist is trying to do is he is trying to achieve health and happiness for you. That's one. He is trying to achieve functionality for you, कि आप फंक्शन करें. यदि आप किसी के पिता हैं, किसी की माता हैं, किसी के शौहर हैं, किसी की बीवी हैं, you should be able to function that way. He also wants sustainable health, कि आज भी आप तंदुरुस्त रहें और कल और परसों और चौथ भी तंदुरुस्त रहें. He wants you to remain healthy for the next few decades. So that is the direction. He is moving or she is moving in the right direction, and the right actions are taken at the right time. This question from Pooja ji is really important, and it is something, Pooja ji, which can be used to fail a student in an endocrinology exam. So madam का सवाल आ रहा है, डॉक्टर जो, is diabetes a lifestyle disease or a hormonal disease?
Yes, sir. Actually, I think Kalra sir is a better person to answer that. He would say of 13 various, he even has a publication जो बोलता है कि it's not just a lifestyle or hormone, it's a combination of so many factors that act together, including the genetics जो है, lifestyle जो है, insulin resistance जो है, insulin deficiency जो है. There are a lot of things that are acting together in one person and finally manifesting itself as diabetes. So in a particular patient, जो लाइफस्टाइल का जो इम्पोर्टेंस है वो ज्यादा रह सकता है. दूसरा जो है उसमें इंसुलिन डेफिशिएंसी का रोल ज्यादा रहता है. अभी बच्चों का टाइप डायबिटीज जो टाइप 1 डायबिटीज जो लेंगे तो ज्यादातर इंसुलिन डेफिशिएंसी की वजह से होता है. इसीलिए हम लोग हर एक टाइप 1 डायबिटीज को इंसुलिन नहीं देते, दवाई उधर काम नहीं करते. ऑन द अदर हैंड, एक ओबीस आदमी जो लाइफस्टाइल बिल्कुल नहीं देखते और उसका बीएमआई बहुत ज्यादा रहता है, उनको देखेंगे तो ज्यादातर लाइफस्टाइल डिजीज रहता है. उनका शरीर में जब हम हार्मोन का लेवल चेक करेंगे, इंसुलिन लेवल चेक करेंगे, तो इंसुलिन लेवल एक्चुअली माइट कम इवन हायर देन नॉर्मल. So still he would be having diabetes. In that case, insulin resistance का वजह से diabetes हो रहा है, and that's more of a lifestyle disease. So it's not a single answer, and I don't know whether Kalsar will fail me for this answer, but it's not a very straightforward answer that we can say. What we have to say is that individuality or individualize करना पड़ेगा. एक आदमी में डेफिशिएंसी की वजह से हो सकता है, दूसरा आदमी में इंसुलिन रेजिस्टेंस के वजह से हो सकता है. एंड देयर आर आल्सो अदर pathways like 12 to 13 pathways which can contribute to diabetes are there now recognized.
बट पूजा जी का सवाल बहुत जायज है. इट इज अ जेन्युइन क्वेश्चन. एंड ऐसे ही कुदरत जी का क्वेश्चन, शी आस्क्ड द सेम थिंग अबाउट ओबेसिटी. व्हाट इज द कॉज ऑफ ओबेसिटी? इज इट अ हार्मोनल डिजीज? इज इट अ लाइफस्टाइल डिसऑर्डर? तो इन सिंपल वर्ड्स इसका आंसर ये है कि जब हम फिजिक्स पढ़ते हैं, एंड वी हैव पीपल फ्रॉम एवरी वॉक ऑफ लाइफ हियर. निशी बाला ने जी ने भी हमें ज्वाइन किया है, वीना बजाज मैडम है, एंड डॉक्टर मोहन शिनॉय फ्रॉम ट्रिवेंड्रम हैज लॉग्ड इन एंड इज सेइंग हाई फाइव टू यू डॉक्टर जो. सो गंगा जी ने भी ज्वाइन किया है, हीना शाह जी हैं. सो जब हम फिजिक्स पढ़ते हैं तो पहले हम पढ़ते थे न्यूटोनियन फिजिक्स. न्यूटोनियन फिजिक्स ये कहता है दैट एवरी एक्शन हैज एन इक्वल एंड ऑपोजिट रिएक्शन. तो आप बस उसको दो तरफा लेते हैं, ये हुआ तो वो हुआ, वो नहीं हुआ तो ये नहीं हुआ. दैट इज न्यूटोनियन. उसके बाद उन्होंने इजाद किया या उन्होंने ढूंढा क्वांटम फिजिक्स. क्वांटम फिजिक्स ये कहता है, बहुत सरल भाषा में, इन वेरी सिंपल वर्ड्स, एनर्जी इज इक्वल टू मैटर. मैटर तो आपको दिखाई देता है, दैट इज टेंजिबल। तो अब आपको पानी दिख रहा है, सडनली आप उस पानी को बदल के उसको ऊर्जा में तब्दील कर देते हैं, यू कन्वर्ट इट इनटू एनर्जी। सो दिस एनर्जी कैन कन्वर्ट इनटू मैटर, द मैटर कैन कन्वर्ट इट इनटू एनर्जी। एंड बहुत सारे तरीके हैं, देयर आर मल्टीपल वेज इन विच दिस क्वांटम डायनामिक्स गोज ऑन। कभी कुछ सम थिंग्स यू कैन सी, अदर थिंग्स यू कैन नॉट सी, some you can feel, others you cannot feel, but you can measure them all. So similarly, we can measure our diabetes and obesity. We can measure our hormones, but how they are interlinked with each other, that is a quantum physics kind of a thing. So it does become difficult to explain. However, in some patients, it is a monogenic or a monofactorial etiology, या एक ही कारण है, एक ही जीन या एक ही फैक्टर है जो खराब है, तो उसकी दवाई देना आसान है, उस फैक्टर को रिप्लेस कर दो या ठीक कर दो। बट ज्यादातर ओबेसिटी में भी और डायबिटीज में भी it is multifactorial, like Dr. Joe has said. Nishiji asked another question, like you are speaking of hormone imbalance and you are speaking of quantum endocrinology now, various hormones mixing up with each other, increasing the energy, reducing the energy. How do these hormones interplay and cause hair fall and alopecia? So, what are the common hormonal diseases which can cause hair loss? This question is from Madam Nishi.
Yeah, see, बेसिकली हेयर हेयर जो है उसका एक साइकिल रहता है, टिलोजन और अनाजन फेज जो है, so it actually is a cyclical thing. There is a phase when there is more hairs that are formed, there is a telogen phase when there is a hair fall जो होता है, and there are a lot of factors, any factors around you, from hormones to the lifestyle to climate and even the water that you use can affect the amount of hair that you lose. But जो hormones के बारे में देखेंगे तो hypothyroidism can produce hair loss, hyperthyroidism can produce hair loss, any serious disease. अब अभी अगर डायबिटीज के बारे में ले लो तो एकदम शुगर हाई हो जाए और कीटो एसिडोसिस हो जाए और बीमार हो जाए आप डायबिटीज के वजह से, तो भी हेयर लॉस हो सकता है। एंड एनी अदर हॉर्मोन्स, मोस्ट ऑफ द हॉर्मोन्स, इफ देयर इज अ सिग्निफिकेंट इम्बैलेंस दैट कैन क्रिएट हेयर लॉस। मेनोपॉज के बाद में ज्यादातर लेडीज बोलते हैं कि दे हैव अ लॉट ऑफ हेयर लॉस दैट इज हैपनिंग। सो इवन आफ्टर डिलीवरी जो प्रेगनेंसी जो रहता है वो इट्स अ फेज ऑफ हार्मोन चेंज, एंड डिलीवरी के बाद जो है इमीडिएटली आफ्टर डिलीवरी पहले 6 से 9 महीने तक there can be excess hair loss that happens. So the most of the hormones, if there is an imbalance, that can lead to hair loss, and commonest of them is thyroid, definitely.
Sharma ji from Lucknow raises a very important point, and what he says is that teamwork is required for health. And he reminds us that we forgot to talk about that single chabi or the single key, which focuses only on the muscles. And that is actually muscle training, resistance training. If you want to build your muscles, you go to the gym and you build your muscles, and you trust the gym trainer for that. What Sharma ji says is that the gym trainer should do his work, that is the muscle building, and you should trust the nutritionist, the nursing specialist, the endocrinologist for other things. If you want to take a hormone, you go to the hormone specialist, ask him or her if it is required. And if you want to learn how to build your muscles, whether to do your biceps or triceps or both, then the gym trainer is the right person. So that is what Mr. Sharma is saying, and thank you, sir, for raising this point. Actually, teamwork is required. In simple Hindi, और इन उर्दू, यदि आपने अपनी कमीज रफू करनी हो, if you want to stitch your shirt, if it is fraying from the edges, तो आप किसके पास जाएंगे? आप मोची के पास जाएंगे क्या? Will you go to the shoemaker? The shoemaker also has a needle and thread. That needle and thread is meant for the shoes, for leather. But you will go to a tailor if you want your shirt stitched properly. You will not use the shoemaker's needle and thread. And which reminds me of an English word, and I love English words. So, ultra crepidarian. This is a word, and let's see if Dr. Mohan or Lalit Kathuria Saab can find for us what this means. Ultra crepidarian. This reminds us of Shashi Tharoor as well, right? So,
Yeah.
yeah. We have another question, and Dr. N.S. Sharda sir, Dr. Joe, Dr. N.S. Sharda sir is very senior physician based in Ahmedabad, and we all respect him a lot. Sir is asking elderly people, people with chronic kidney disease, who have a lot of weakness. Sometimes we give them very small doses of anabolic steroids like decadurabolin. Is this okay for elderly people who are not functional enough? Maybe the person's muscles are so weak that he's not able to go to the bathroom himself or herself.
Sir, you have put me in a very big dilemma. But physiologically speaking, we have to see the anabolic the muscle building. This decadurabolin has been given in severe emaciation, especially after severe critical illness, and sometimes just to make the patient mobile. I know that it has been done, but most of the time we should always balance it with the risk and benefit ratio, because all these elderly people, they might be having some subclinical coronary artery disease, and they might be having some impaired glucose tolerance. All these can have a negative impact, and uh, it's a scenario where you have to sometimes balance between the risk and the benefit. And sometimes for a short period, for a 1 or 2 injections I've seen, and I've also seen people using it for the benefit. These are we have to take it from the individualized perspective. That's what I feel. So there is no definite recommendation as per to use it as a random thing for every patient or elderly who is not able to move or not able to walk. We have to support them in the, as the UP teacher has rightly pointed out, the exercise and physical activity, proper nutritious diet. These are things to be always taken care of. Proper sunlight exposure. These people may not having enough sunlight. So physiotherapy, exercise, and diet has to be there. And some cases, just for that sake of, in that very rare case scenarios where we may have to really use it. Sir Carlos, sir, I think you should also add few points to it.
I fully agree with you, Dr. Joe. The best treatment is diet and exercise and sunlight, yeah, like you've said. And these are the best exercise, the best treatments for anti-aging as well. So I think, Dr. Joe, that is a perfect answer. Uh, Dr. Sharda, sir, there would be something known as temple therapy or mosque therapy or church therapy. So this I learned from my friend in Gwalior. His name is Dr. Navneet Agarwal. So when he is faced with a patient who is not able to control her glucose or not able to reduce her weight, then he suggests temple therapy. So we'll say, Madam, which part of the city do you live in? So suppose she says, I live in sector 14. So then, okay, why don't you go to that temple in sector 13? It is 1 kilometer away. You have to go on foot. And I promise you, madam, I am prescribing you these medicines and these insulins. I promise you, if you go to that temple every day on foot, remember not to go barefoot. So you have to go on foot and then you have to come back on foot. If you get tired, you can stop on the way. There's no issue with it. I promise you, these medicines are going to act and your sugar will come down or your weight will begin to fall. So she begins doing that, and then after a week she comes back and says, yeah, I have done it, but my glucose hasn't come down. He says, yeah, this is the first step of the temple therapy. Now I think you should go to the temple in sector 12. So that is 2 kilometers away. So why don't we do that walk once a day? So Dr. Sharda sir, for the elderly people, if we try temple therapy, I think that may work. We make sure that they get out of their beds and their homes and they go for that walk, and it actually does help. Dr. Navneet is one of the most popular diabetologists in the entire Madhya Pradesh because of this temple therapy. Does it work, Dr. Joe, in Calicut as well?
Yeah, see, see, depending on the age group, I would rather advise. Sometimes I advise mall therapy, because once they reach the mall, they just walk around from morning
Yeah.
to evening. They see, it depends on what they enjoy. Some people enjoy temple, some others enjoy the mall, walking in the mall, and some people even, yeah, it will actually, it depends. And finally, whatever is said and done, finally, if you move, it actually
Hmm.
shows some benefit somewhere.
That is what we should encourage. So entire India should keep on moving. We are meant to move. गंगा जी एक क्वेश्चन पूछ रहे हैं हिंदी में, सर हाइपोथायरॉयडिज्म में टीएसएच टेस्ट करवाना चाहिए। तो मैं टैबलेट ले रही हूँ थायराइड की, तो सुबह में टैबलेट खा के टीएसएच करवाऊं या बगैर टैबलेट के करवाऊं, या इट डजंट मेक अ डिफरेंस एट ऑल?
एक्चुअली इट डजेंट मेक अ डिफरेंस एट ऑल। अगर आप टैबलेट लेके करते हैं, ना लेके करते हैं, टीएसएच में कोई फर्क नहीं पड़ता है, क्योंकि जो टीएसएच जो वैल्यू जो रहता है, वो एक एवरेज वैल्यू जो है, और उसका जो इट एक्चुअली डिपेंड्स ऑन द इट हैज अ हाफ लाइफ। द वैल्यू जो जो रहता है, इट डजेंट मैटर वेदर यू टेक द मॉर्निंग टैबलेट और नॉट। बट यूजुअली व्हाट वी रिकमेंड इज टू टेक द टैबलेट एंड गो एंड डू द टेस्टिंग, बिकॉज थायराइड का जो टैबलेट है, वो एक दिन भी मिस नहीं करना चाहिए आपको। अगर डॉक्टर ने बताया हो कि हर दिन लेना है, तो वैसे ही लेना चाहिए, और सुबह में गोली लेके ही जाके टेस्ट करना है। इट डजंट मेक मच ऑफ अ डिफरेंस।
Dr. Mohan, thanks you for the discussion that you had on direct access testing, how that can be harmful. And Dr. Pawar, sir is 72 years young. So Mrs. Pawar is also 70 years young, and she has been taking 125 microgram thyroxine for the past 1 year. So Dr. Pawar sir is asking, apart from the TSH, are there any other tests which are mandatory? And at roughly what interval should she get them done?
Yeah, see, sir, थायराइड का हार्मोन को हाइपोथायरॉइडिज्म में थायराइड का लेवल ठीक है कि नहीं वो पता करने के लिए टीएसएच काफी रहता है. We have to keep that within the physiological normal range. Only thing is that physiological normal range जो रहता है वो एज के जरिए थोड़ा चेंज हो सकता है. Above 50 to 60 we would think of a TSH value of 5 or 6 as okay, and at 60 to 70 to 80 we may take a TSH value of 7 as okay. So it depends on the age also. अगर या जैसे कलर सर ने बताया आप 70 और 80 के बीच में हो या 65 और 75 के बीच में है तो आपके लिए a TSH value between 4 to 7 I would be taking it as perfectly normal, and I would be just maintaining that dose. I wouldn't be wanting to go down to a TSH value of 1 or 2, and I wouldn't be wanting to go to a value of 8 or 10 of that. I would be trying to maintain it between that range of say 4 to 7. That's it. And उसके लिए TSH काफी रहता है.
इसको डॉक्टर पवार सर गोल्डीलॉक्स जोन कहते हैं. तो गोल्डीलॉक्स की स्टोरी हम सबने पढ़ी है. डॉक्टर पवार इज अ pediatrician, so his patients have also read the story. So when Goldilocks went to the bear's house, she saw that one thyroxine tablet was too big and the other one was too small and the other one was just right. So that just right range is different. In general, जितनी ज्यादा उम्र उतना ही ज्यादा हमारा नॉर्मल थायराइड. So this is answering all the questions by Kavita ji, डॉक्टर अस्मिता, ज्योतिका जी, बाय सो मेनी पीपल. एंड जितनी कम उम्र उतना ही ज्यादा थायराइड की डोज की रिक्वायरमेंट पर केजी बॉडी वेट. तो जो बच्चा होगा 2 साल का, 4 साल का, उसको पर केजी बॉडी वेट 5 या 7 माइक्रोग्राम भी हो सकता है चाहिए हो. मगर जो कोई महिला या कोई आदमी होंगे, अडल्ट्स होंगे, उनका 1.5 माइक्रोग्राम से काम चल जाएगा. एल्डरली लोगों का उससे भी कम, हाफ माइक्रोग्राम पर केजी बॉडी वेट से भी काम चल जाएगा. And Dr. Khilinder Saxena is a gynecologist. He reminds us that in pregnancy, the rules are different and the normal values are different.
Yes.
So, Dr. Joe, just a brief comment about misuse of hormones during pregnancy. Anything that you've come across when people check their prolactin during pregnancies?
Yeah, prolactin during pregnancy. Actually, prolactin I think is more misused in evaluation of infertility. Pregnancy में ज़्यादातर हमारे in this area people don't do prolactin that much, but thyroid function it's done in the first trimester. ज़्यादातर problem hyperthyroidism के ऊपर होता है. TSH कम आता है, वो HCG जो pregnancy का जो शुरुआत में जो हार्मोन रहता है उसके वजह से TSH कम रह सकता है. और ये देख के there are a lot of people who might unwantingly or requirement, there is no requirement, but still would prescribe antithyroid drugs. That is the commonest misuse I see in pregnancy. Antithyroid drugs being prescribed for a suppressed TSH.
And Joe, we have that Shakespeare answer, and the answer has come from Trivandrum, from Dr. Mohan. So an ultra crepidarian, अरे बोलना भी इतना मुश्किल है, मैंने पंगा क्यों ले लिया? An ultra crepidarian is a person who offers opinion beyond their knowledge. So actually, ultra is beyond, and crepid is a shoemaker. So actually, there is this story from Latin, from ancient Rome, where there was this shoemaker who saw a painting and he criticized that painting. Now the painting had been made by like somebody like M.F. Hussain, like by a senior guy. So the painter said, "Fine, you're right. Let me make a change." And then that shoemaker kept on making more and more changes, giving more and more advice. And then finally, the maestro, the painter said, "Shoemaker, no more, no further. You stick to your shoes. Let me stick to my painting." So crepidarius comes from shoe and ultra comes from beyond. So this is used in situations, Dr. Mohan tells us, when someone speaks as an authority on a subject that they have limited knowledge of. अब सब लोग हम इंडिया में रहते हैं, जो बाहर से भी सुन रहे हैं वो भी इंडिया को अच्छे से जानते हैं. तो इंडिया में 1300 मिलियन क्रिकेट एक्सपर्ट्स हैं, 1300 मिलियन पॉलिटिकल एक्सपर्ट्स हैं. अब कॉमनवेल्थ गेम में हमारे जब खिलाड़ी ब्रॉन्ज मेडल लेते हैं तो 1300 मिलियन लोग हैं बताने वाले, यार तूने सिल्वर क्यों नहीं लिया? 1300 मिलियन टोकने वाले हैं, सिल्वर वाले ने गोल्ड क्यों नहीं लिया? So we have 1300 million ultra crepidarians in our country, and I wish them all the best. साथ में Vikram Dhillon ji
Yeah,
भी logged in है,
that's
so
that's the
yeah.
problem in Kerala also, because a lot of YouTube videos that are viral are actually produced and uploaded by people who call themselves doctors, but they do not have any medical degree as such. They call them. See, nobody is there to verify. Nobody is there to look into the authenticity of the person, and that's a big problem that is happening, because the person who looks into the video which comes up, they would see the name as a doctor and they would believe that it's a doctor without, but actually he's a person without any medical degree.
Hmm. Yeah, that's true. And it's 7:50 already, Dr. Joe. I know that you have to leave at 8, but Nina Agiji, who is a socialite from Karnal, greets you. Manjula ji, madam is a 78-year young gynecologist. Thank you, madam, for saying that. Maza aa gaya. So 3 cheers for Madam Manjula. She is 78 years young. Dr. Joe and I will also want to be 78 years young sometime
Yes.
in future. She takes 50 microgram, not milligram, microgram thyroxine, ma'am. And if your TSH is fine, that's great. Swapna Jainji from Vellore in Tamil Nadu reminds us it is our 75th Independence Day coming up. So let's pledge to keep on moving. Let's make our hormones happy and healthy. Thank you, madam, for sharing that. Dr. Saxena is asking, he's a gynecologist, like we said, elective cesarean wale din in the morning, should we give thyroxine or should we not give? Can I omit for one day?
See, we should give it. We should give it in the first, with a small sip of water in the morning, empty stomach, even on the day of surgery. Every surgery, let it be even coronary bypass or any other surgery, let it leave alone cesarean section. Any surgery, on the day of surgery, in a small sip of water, we should give the thyroxine dose. That's my opinion, and that's a usual opinion.
Uh, Dr. Vipin Mandula shares a case of a lady who had a TSH of 60. She was put on thyroxine 75 microgram, and now she came in after 6 months with a TSH of 0.02. This tells us that we should be monitoring more frequently. Maybe in this patient, especially if she was very thin, very old, maybe she was on multiple other drugs, or you felt that there's going to be a stormy clinical course, maybe we could have checked the thyroxine, the TSH level every 6 weeks also. In pregnancy, sometimes we take it 4 weeks also, Dr. Vipin. But 1.5 months we should have checked. If we had done that, we could have reduced the dose earlier. Okay, and Jyotika ji, a question पूछ रही हैं. I am a thyroid patient for the last 11 years, taking 50 microgram, and Jyotika, not milli, microgram of thyroxine. My weight is stuck on my lower abdomen. वो तो मेरा भी है. Is it due to hormones? नहीं नहीं, please don't laugh, Dr. Joe. And pre-menopause भी चल रहा है. Yeah, so menopause is a time when there is a lot of fluctuation in thyroid. So do we have drugs available now to reduce weight, and how much of that weight can be blamed on hypothyroidism?
See, I already mentioned. See, thyroid is mentioned as a reason for weight gain, but most often the amount of weight that you gain by hypothyroidism is only 3 to 5%. So when you treat hypothyroidism, maximum weight loss that you may get in a severe hypothyroid is just 5% of the total weight. So when you look at your total weight, if you're really hypothyroid, the amount of weight loss that can be expected is just 3 to 5%. That's very minimal. And as Kalrasar has pointed out, even I am having a abdominal circumference that is slightly higher nowadays. So after the COVID, I also gained in my abdominal circumference. So it's something more to do with lifestyle and also on the muscle strength. So we need to do more of abdominal exercise, general exercise for the physical well-being, and toning up the abdominal muscles can actually reduce the abdominal circumference. And though I laughed it, I was actually laughing at myself because I was thinking of my own exercise regime, which I left somewhere during my COVID time and has just restarted.
Yeah, but Jyotika ji, you're not alone. एक तो ये देखो ना, KK Metox का फायदा क्या होता है? You suddenly don't feel lonely anymore. You feel that everybody is with you. And one of my patients, he's actually very, very young. In a very nice and jovial manner, he happened to call me a laddu a couple of months ago. And after that, I started going to the gym again. So thank you, patient ji, for pushing me to go to the gym. Dr. Utsav is with us. Dr. Utsav Sahu is a dynamic physician from New Delhi. He says, I have a challenge. This is young, smart boys who have been put on testosterone supplements by their gym trainers, and they misuse these hormones, testosterone. Then they land up with erectile dysfunction with infertility, and with low energy after stopping these. How do I deal with them and how do I counsel them? That is his question.
Yeah, see, when you give testosterone, first and foremost thing is we need to increase the awareness among our younger generation not to use these drugs, because seeing these small ads, see, everybody wants a fast answer to this muscle building. We should actually increase the awareness and try to prevent this from happening. But once this happens, what the data says is that usually the hormone recovers by itself within the next 4 months to 1 year. So if the person has stopped taking the hormone usually come back to normal within the next 4 months to 1 year, depending on the age group. Younger age में जल्दी recovery हो जाता है. Older ages में the recovery may take more time, and also the recovery depends on the amount of dose that was given initially. A higher dose लेते हैं तो recovery में maybe delay हो सकता है. Smaller doses में recovery ज़्यादा जल्दी हो जाता है. There are few methods which are mentioned of drugs which could reactivate the hormone system, but it's actually something that you may take on an individualized basis. Some people may give it just to improve the confidence of the patient, but otherwise one thing we should always understand is that it is something, see, our body is a very strong thing. We should understand the strength of our mind and our body and our hormone system and the balance that the body maintains. So anything that has been interfered from outside, which is unethical or illegal or unwanted, when you stop it, our body has tremendous capacity to regain it back, and the body does it by themselves. So we don't have to too much worry. What we need to give more is tender loving care and understanding of the scenario, and in giving them the confidence that things are going to get back to normal.
Tell them that there's no point in crying over spilt milk, but certainly, as responsible citizens, it is their duty to tell other people, to tell their friends, their peers, their brothers-in-law, not to go the same way. If they climbed the wrong coconut tree, it doesn't mean that other people should also climb the wrong coconut tree. So that is one thing. You instill a sense of responsibility in them. Secondly, you instill a sense of confidence, like Dr. Joe is saying, with tender, loving care, and you tell them that the focus should be on lifestyle modification now, diet and exercise, sunlight, and the body has a tremendous capacity to heal itself. Dr. Shubhlata Chetwal, Madam, Dr. Jo, she is a senior physician from New Delhi, and she says that we should encourage temple therapy, church therapy in everybody. Even जब नमाज पढ़ते हैं, तो आप सबको encourage करें पूरे रकात पढ़ने के लिए, 17 रकात पढ़ने के लिए. So that is also a type of exercise, and you get dual benefit. One, you will get spiritual health, and secondly, you will also get physical health. So both will improve. And Dr. Vipin says tongue in cheek that young ladies improve with mall therapy. So he's thanking you, Dr. Jo, for giving him that idea. And now from the smile, we realize why Dr. Joe is a very sought after physician in Calicut. बिल्ली जी पॉइंट आउट कर रही हैं, थैंक यू बिल्ली जी फॉर पॉइंटिंग आउट कि माइक्रोग्राम और मिलीग्राम में कंफ्यूज मत होएं. जो थायराइड की दवाई है वो माइक्रोग्राम में होती है, मिलीग्राम में नहीं होती. So thanks for pointing that out. And we've had lots and lots of questions and comments. It's nearly 8, but let us take 2 comments from Dr. Mohan. So the first is, he says that pre-diabetes offers a window of opportunity for improving metabolic health of the country. So what is your comment on that, Dr. Jo?
Yes, sir. It's always prevention is always better than cure. And see, primordial prevention, that is a prevention of risk factors before it happens, or when the initial part of the risk factor happens, is something that we should aim at. That should be the aim for the future. And we see, Abhi Dekho, I don't know whether I should say that, but community medicine or preventive medicine is the least sought after. It was the least sought after classes. We always used to go for the medicine, surgery, and those thing, but community medicine and the preventive medicine is the something that prevents the disease, and that should be in the forefront of any community, any country. And I feel that as India as a country and the healthcare in India, we should be more concentrating on primordial prevention of chronic diseases. And one such case is identifying pre-diabetes and treating it and removing the diabetes from its root itself, so that there is no diabetic at all in the future.
Mahesh Chauhanji shares, that concept about quantum physics. So E is equal to mc square, and he says that the physicists have been able to find E is equal to mc square, but in endocrinology there is still a lot we need to learn, and we need to have different equations for each different individual. So do trust your endocrinologist if you feel there is any issue about use or misuse of hormones. Dr. Mohan, this is the last comment. He reminds us that India is doing very well at the Commonwealth Games. And he asks you, Dr. Joe, what can we all do as Indians? What can we all do to improve the sports performance of our country? What is our responsibility as members of the public, as endocrinologists, as gym trainers, as physiotherapists?
See, when any child walks into my OP, I ask them, what do you do as an extracurricular activity? You are tall enough. Don't you play basketball? And I ask a girl or boy comes in. I look in just as a random. I ask, you look like a good sports person. Why don't you play something? Why don't you join something? So this, and even when a child with overweight or obesity walks in, I always tell them not about exercise. Tell them about activity, sports activity, and I tell them about our PT Usha from our own Kerala, who has run and gave us so many credits, and so there are so many sports persons which we can take as our role models. So I think we should, in each and every point of view, when you see a diabetic and a daughter that is walking in, who is a young girl or a granddaughter who is walking in along with the patient who is having slight obesity, or you see that there's some acanthosis that is developing there, that also we should promote sports activity. And I think we should, our academic uh, the system of schooling should also include more of prominence to the sports, and also they should allot more time. I always feel that the classes should be there from morning to afternoon, and afternoon after lunch it should be a time where people should be exercising or doing some extracurricular activity, and also learning on how to have build up themselves as a proper person, not from the mind, personality, and also from the activity point of view. How to wash clothes, how to make a garden for themselves, how to play, how to behave, how to behave with their subordinates, how to behave with the people who are in need, and the virtues of life. That also should occupy a lot of space in the curriculum.
Right. So thank you, Dr. Joe, for that answer. And I think with that thought, uh, we are now more equipped, more empowered, and more enthusiastic as well about fulfilling our role as responsible citizens. We all need to work not only at an individual level in ourselves and our families, but at a greater level to encourage everyone around us to exercise. I acknowledge all the questions that have come on skin, parathyroid, adrenal, and we promise you that we will take sessions in KK Med Talks in the near future on these topics. हिना जी, हाशिमोटोस थायराइडाइटिस एक कारण है हाइपोथायरॉयडिज्म का, और इंडिया में अराउंड, इफ आई एम नॉट मिस्टेकन डॉक्टर जो, अराउंड 95 to 98% of all hypothyroidism in India will be Hashimoto's thyroiditis. तो हाशिमोटो कारण है जैसे डॉक्टर जो बोल रहे थे, और हाइपोथायराइड बीमारी है जिसका हमें इलाज करना है. Also greetings to you from Haryana, from Dr. Sonika Lamba. She is professor of medicine at our prestigious women's college, and she is thanking you for your explanations.
Thank you.
आप सबको मिलके बहुत अच्छा लगा, and Dr. Joe, it's been great being with you today. If you allow, could we share a certificate of appreciation with you? Pratik will share that from the back end.
It's a pleasure. It's a pleasure being with you, sir.
On behalf of everybody, we'd like to ask you for one final take home. You've talked to us about what we can do in the OPD, encourage everybody to exercise, to play games, to sports. And remember PT Usha, remember Anju Bobby George. Till last week, she was the only Indian to have won a medal at the World Athletics Championships. And we are very happy that Neeraj Chopra has joined her there. And we wish that 100 more Anjus and Neerajas would join them in the coming decades. But great thought, and last words from you, Dr. Joe, before we conclude.
Yeah, see, what I would like to say is that about the hormone abuse, it's something which has been not recognized as a major problem, because the US, we don't have too many data on that. Even the adverse effects of these hormones has not been assessed fully, because is a significant lack of data. But the international data says that it is much more than what we suspect. And our younger generation, especially the younger generation, are coming up with different kind of body images and different kind of scenarios, and the lifestyle is moving towards a fast food kind of scenario, that everybody wants every result fast, not the right way. need not be the right way. So the hormone abuse as a major problem, I feel that it might, unless we take serious steps as doctors, as responsible citizens of India, if we don't take serious look into it, it may become snowball into a major issue, which could take away the next generation of Indians, healthy Indians from us. So we should be aware of it. We should be taking more care about it. We should be uh, giving more education and widespread coverage to the problems associated with it. And I think government has to play a role, but we as responsible citizens has to also play a role. Like tomorrow we see somebody whom we suspect it, we should not leave that, okay, ये हमारा कौन लगता है, ये ऐसा करने दो, ऐसा, don't think that that could also happen to us in our family also. And we should be acting responsibly, because any person who might be lying down, or you may be seeing accidentally doing hormone misuse, is somebody else's son or a daughter, or so we should always take it in that responsible point of view and try to be a responsible citizen and to identify and try to correct it. That's what I feel, sir.
थैंक यू डॉक्टर जो, एंड दैट इज व्हाट वी ट्राई टू डू ऑन केके मेड टॉक्स। हम अवेयरनेस फैलाते हैं हेल्थ के बारे में, सेहत के बारे में। जैसे डॉक्टर जो ने कहा, जैसे आप सब्सटेंस अब्यूज को देखते हैं, वैसे ही आप हार्मोन मिसयूज को देखें। एंड इट इज टू इम्पोर्टेंट टू बी लेफ्ट टू एनी इंडिविजुअल, इट इज टू इम्पोर्टेंट टू बी लेफ्ट टू द गवर्नमेंट। हम सबकी जिम्मेवारी है, हम सबकी रिस्पॉन्सिबिलिटी है टू लुक फॉर एंड टू प्रिवेंट एंड टू मिटिगेट द इफेक्ट्स ऑफ हार्मोन मिसयूज। इस सबके साथ आप सबको शुक्रिया करेंगे फॉर बीइंग विद अस। जैसे कि आप जानते हैं, केके में टॉक्स रोज आपकी सेवा में हाजिर होता है 7 से 8, और मैं आपके पास होता हूं हर सोमवार और वीरवार। इस वीरवार हमारे गेस्ट होंगे डॉक्टर मीनाक्षी वर्मा। मैडम इज अ पीडियाट्रिशियन ट्रेन्ड एट पीजीआई चंडीगढ़, और वो पंचकुला में प्रैक्टिस करती हैं। वो बात करेंगी बच्चों में कोविड के क्या इफेक्ट्स हुए हैं, द इफेक्ट्स ऑफ कोविड इन चिल्ड्रन, द लॉन्ग टर्म इफेक्ट्स, एंड हाउ वी कैन मिटिगेट देम, नॉट ओनली फिजिकल हेल्थ बट ऑल्सो सोशल हेल्थ, जो दिक्कतें आई हैं। इस सबसे आप सबसे इस चीज के साथ आप सबसे इजाजत लेते हैं। शुक्रिया, मेहरबानी, धन्यवाद फॉर बीइंग विद अस। थैंक यू डॉक्टर जो, और जय हिंद।
Thank you, sir. Thank you, sir.